role of acquired. So in acquired hepatocerebral degeneration, there is liver impairment, which is leading to the neurological dysfunction, causing acquired hepatocerebral degeneration. The main symptoms of acquired hepatocerebral degeneration are movement disorders, cognitive dysfunction, and neuropsychiatric symptomology. So now, is it only the only disease, whether acquired hepatocerebral degeneration, is it the only interconnected disease where we can tell that liver health is contributing to the neurological health? No, there are many diseases. For example, hepatic encephalopathy. So all of you know hepatic encephalopathy. So a patient of, for example, alcoholic liver disease disorder comes. He is having a very resistant ascites where he is not reacting to or uh, responding well to contemporary medicines or Ayurveda medicines. In such condition, he may land up in hepatic encephalopathy due to the neurotoxins like ammonia. So ammonia is not excreted properly. Due to that over accumulation of the ammonia, it enters the blood-brain barrier, and then the patient will develop hepatic encephalopathy. So flapping tremors are one of the important symptom of hepatic encephalopathy. So this disorder is also an interconnected disorder, which somewhere telling us that liver health and brain health are somewhere dependent on each other. The third disorder is stroke, because as you all know, the main important function of liver is detoxification, and it also produces clotting factors. It is important for the glucose metabolism, the fat storage, the glucose glycogen synthesis, and all the metabolism of it. So it is, as I told you, it is also an important factor or an important contributor to coagulation factors. So whenever there is impairment is there, so whenever there is liver failure or any disorder where the liver is not been given an opportunity to function properly, then there is impairment in the coagulation factors, which can lead to diseases like stroke. So this also shows that there is a relationship between the liver and the brain health. The fourth category are neurodegenerative diseases, in which I'm taking an example of Alzheimer's disease. So for Alzheimer's disease, all of you know that there is amyloid beta component which is accumulated in the brain, which is resulting in Alzheimer's disease. So why it is getting accumulated? Because for the clearance of amyloid beta protein, liver is responsible. So if liver is not functioning properly, amyloid beta protein is not getting cleared properly out of the system, it is accumulating in the brain, leading to the Alzheimer's disease. So now this is also a disease which will show the interconnectedness between the brain and the liver. So the fourth one is hepatic responses to cerebral lesions. So it can be a traumatic brain injury, or it can be any inflammatory condition, or it can be any condition which is influencing the peripheral regulation of the brain function. So all of them depend on the liver metabolism. For example, for the medicines to be absorbed properly, for the medicines to reach the blood-brain barrier, the medicines to undergo a proper first half period, or all of this, liver is responsible. In fact, for all the metabolism, liver is responsible. So indirectly for the inflammation also, liver it is responsible. So for all cerebral lesions, now also you can find the interconnectedness between the liver health and the brain health. So now what are the communication pathways? So now, so we came to know what is acquired hepatocerebral degeneration, and there is an established relationship between the liver and the brain, and what are the symptoms of acquired hepatocerebral degeneration. And apart from acquired hepatocerebral degeneration, there are also other diseases which will prove that there is a pathway in this. So now we have established that. So now how do the communication with this pathway happen? So this communication happens with three important networks. One is hepatokines, second one is metabolites, and third one neural pathways. So hepatokines, so there is also an endocrine function of the liver. So it produces some of the hormones, or you can also say proteins, such as hepatokines. For example, you have FGF21 or ANGPTL8. So you can Google and know all of the long terms. So these transmit the metabolic signals to the brain via the bloodstream. So whatever the metabolic, what is the metabolic status of the body? So that will be transmitted via hepatokines from the liver to the brain. So this also became a very efficient communication pathway. The second one is metabolites. So metabolites, they are either generated from the liver or also gut microbiota. Okay, so either they can go from the liver directly or from the gut microbiota, or they can be secreted from the liver or some from the gut microbiota. So they also facilitate a communication pathway between the liver and the brain. Examples, for example, like we can take the example of ammonia. So from the gut, it is transmitted to the brain. So why ammonia clearance didn't happen properly? Because there was a liver disorder. So and what did it happen? When ammonia clearance didn't happen, it led to the hepatic encephalopathy. So now these metabolites also establish a very good communication pathway between the liver and the brain. Next is neuronal pathway, particularly the hypothalamic nuclei and the autonomic nervous system. They also modulate the bilateral metabolic interplay between the cerebral and the hepatic compartments. So you have hypothalamic nuclei and also the ANS autonomic nervous system. So via the neuronal network also there is a communication directly between the liver compartments and the brain compartments. So now the crosstalk or the communication is happening via these three: hepatokines, metabolites, neuronal pathway. So now we will know about the metabolic crosstalk between the liver and the brain. So brushing up, we have known about the hepatocellular degeneration. We have known now that it's a crosstalk and by how the communication is happening. It is happening by hepatokines. It is happening by the neuronal pathway, and it is also happening by the metabolites. So for example, so now we will take this particular example here. You can see, so there is a liver. We'll think that now the patient is suffering from a structural liver disease. It can be non-alcoholic fatty liver disease, or it can be NASH, or that is non-alcoholic steatohepatitis, or any other disease. We can also take cirrhotic liver disease. So that leads to liver injury or a complication such as hepatic encephalopathy. So now liver impairment causing the neuronal impairment leading to hepatoencephalopathy, and these are the categories of patient due to the peripheral amyloid beta clearance. As I already told you, amyloid beta, this component is responsible for the Alzheimer's disease or dementia, and that clearance it will happen in the liver. But liver is already suffering from a structural liver disease, so this clearance is not happening properly. It is leading to Alzheimer's disease or dementia, or it can be APOE4 from the liver. Again, it has to be cleared from the liver. It has to modulate the inflammation. It is not happening properly. It is leading to stroke, and also the thrombotic brain injury and peripheral neuropathies. So all the APP cytokines, these are the inflammatory markers. They have to be cleared by the liver, and whenever the liver is already suffering from a structural liver disease, then there will be no modulation for the inflammation. That will more lead to or more aggravate the peripheral neuropathy or traumatic brain injury. So it is like you're having a good parent or a good teacher. So you have done any mistake, for example, you have done any mistake, you're going and telling this to your mom. Okay, so whenever your father comes to know about this, your mom will stand there and protect you. She will say that no, it was not her mistake, it was not his mistake, so it happened from somewhere else. So then the impact of your father's scolding will be less, or your father will be convinced that okay, it is not the kid's problem. But if the mother is not safeguarding the kid, now what will happen? The direct anger of the dad will go to the kid. Right? There will be no one to convince the dad that okay, the kid has not done any mistake. Similarly, the liver will play the role of the mother here. Okay, so for the brain not to be impaired, liver is very much essential. So if you're not bypassing the liver, or the liver is already fed up by so many metabolic problems, it can be fatty liver, or it can be cirrhosis, or it can be hepatitis, or it can be any ballooning of the hepatocytes or any other disease of the liver, then the brain will not be potent enough to safeguard itself. For example, let us take a patient of diabetes mellitus. So all of you are very much well aware of diabetes mellitus. So there are two patients of diabetes mellitus. One patient is having a fatty liver with diabetes mellitus, because fatty liver is one of the component of metabolic disorder also, and diabetes is also a metabolic disorder. And now there is a second patient where there is only diabetes mellitus. The patient is having a comparatively healthy liver. There is no grade 1 fatty liver, or the patient is non-alcoholic, non-smoker. So the liver is comparatively healthy. So amongst these two patients, the first patient where he's also having diabetes mellitus, he's also having fat liver. For him, there are more chances that he will develop the peripheral neuropathy, because to control that inflammation, to control that effect of the metabolic disorder, liver is not healthy enough. But in the same patient of diabetes mellitus, if the liver is healthy, then there are very chances that he will not develop peripheral neuropathy. Okay, this is what I'm trying to say. Yes. So now a very important topic, that is liver's role in neurodegeneration. So neurodegeneration, it refers to all the degenerative disorders of the brain. It can be Alzheimer's or it can be Parkinsonism. So all the set of degenerative diseases. We are not speaking about the other category of the diseases which are caused by the inflammation or autoimmune diseases. We are directly focusing on the neurodegeneration. So this is an emerging therapeutic concept of neurodegenerative diseases, where brain energy rescue highlights the similarities between pathogenesis of neurodegenerative diseases and metabolic syndrome. So liver here is a key regulator of both. So it can be the metabolic syndrome. There also we need a very healthy liver, or it can be a neurodegenerative disease. There also we need a healthy liver. So now healthy liver is a key regulator of both the neurodegenerative diseases and the metabolic syndrome. So now metabolomics is a very important emerging branch of science, which shows us the relationship between the genomics, the genes, and the diseases. Right. So now the liver is the earliest affected organ during the amyloid pathology cascade in APP-PS1 mice at 5 months of age, manifesting as hepatic hypometabolism and perturbated metabolites mainly involved in amino acid metabolism. So now this particular research, which was done on mice, okay, this shown that in the amyloid pathological cascade, that is in the Alzheimer's disease, whenever they did this particular research, it shown that the liver was the earliest affected organ. So here metabolics have shown the liver was the earliest affected organ. So we usually think that during Alzheimer's or Parkinsonism, that brain is the earliest organ which has been affected. But this particular research is giving us a very surprising output that liver was the first affected organ. So liver got affected, then the metabolic changes were seen, which led to the neurodegeneration or neurodegenerative diseases. So the same thing what I told you as amyloid beta clearance pathology can be understood here. Okay, why amyloid beta clearance was not happening? Why it led to Alzheimer's disease? Because in that condition, the liver was the earliest affected organ. So now this is a very valid point for us to say that liver has an important role in neurodegeneration. And along with that, so as I already told you, metabolites and gut microbiota, it is also an effective communication pathway between the brain and the liver. So once the liver is affected, then definitely the nucleic acid metabolism, the fatty acids metabolism, energy metabolism, ketone body metabolism, all of them will also be impaired. And these metabolites directly give away this important information that something is wrong with the body, something along with the body metabolism is not right. It is going towards the hepatic hypometabolism. So hepatic hypometabolism, body is landing towards hepatic hypometabolism. This important information is given away by these metabolites to the liver, which again leads to the neurodegeneration. So now the second point. So in diseases especially, so this particular research says that with non-alcoholic fatty liver disease, NFALD is non-alcoholic fatty liver disease. So the liver dysfunction correlates with the cognitive decline. I quoted a very important research about PCOS. So I told you that it is also a cognitive disorder. Now, similarly, this particular research is telling us that non-alcoholic fatty liver disease, so it is a metabolic disease. It is also known as metabolic dysfunction associated fatty liver disease. Okay. So now along with the metabolic symptoms, this particular disease is also having cognitive decline. So when the research was done on non-alcoholic fatty liver disease patients, they also shown that there is a cognitive decline. So whenever cognitive decline comes, it is the function of the brain. It is the neurological health what we are discussing about. So the fibrosis of the liver, or it can be non-alcoholic fatty liver disease, it contributed to the cognitive decline, showing us that the non-alcoholic liver disease, the compensated liver health also resulted in cognitive decline. Again, there is an example now. We are studying that non-alcoholic fatty liver disease leads to neurodegeneration. So hence, our point is once again proved that liver's role is very much important in neurodegeneration. So now there was an experiment which was done. So lower density lipoprotein receptor related protein, that is LRP1, and amyloid beta levels in the liver tissue of rats and mice with NFALD were reduced. This decreases correlated inversely with alpha beta levels in the brain and plasma as well as a cognitive function. So this was again a research which was done on mice, where they shown that the non-alcoholic fatty liver disease mice, they had the reduced levels of amyloid beta and low density lipoprotein receptor related protein. Okay, now the third one, which is again related to the cognitive impairment, as we saw in the previous experiment, which was done on non-alcoholic fatty liver disease. So again, this was again done on the low lipoprotein receptor related protein and also on the amyloid beta accumulation. It also resulted in the cognitive impairment. So now there is a negative effect of the NFALD on peripheral alpha beta clearance. Peripheral because now the liver is involved, right? So alpha beta protein, it is accumulated is getting accumulated in the brain. The clearance should have happened in the peripheral, that is in the liver. But as the liver is suffering from non-alcoholic fatty liver disease, so because nowadays people nowhere give importance to fatty liver disease. So many of the times they get the master health checkup, or they go for sonography, then there is fatty liver disease, and they many of the doctors, they say that okay, lifestyle modifications is enough. The patient comes home, neither he remembers that he's having fatty liver, neither he remembers that he should improve his lifestyle, his dietary habits to get through the fatty liver. So it is much, many of the times it is neglected. But even such a simple disease as fatty liver disease, it can lead to the decreased peripheral amyloid beta clearance. And in the future, if he's not following good dietary habits, not following the good exercises, not following good lifestyle, he may land up in any of the disorders which will have, which has been caused by the decreased amyloid beta clearance. It can be dementia, or it can be cognitive decline, or memory issues, or it can even be serious as Alzheimer's disease. Okay, so now we have proved that there is a liver's role in neurodegeneration. One, via the metabolites. So whenever hypometabolism, liver is landing in hepatic hypometabolism, the metabolites directly give away to the brain that this is a time for us to go for neurodegeneration. Second one, many of the research, they show that even such simple diseases like NFALD, they contribute to the peripheral clearance of amyloid beta protein, which can either land up in cognitive issues such as memory issues or Alzheimer's, or it can be any cognitive decline. So now we have established that there is an important role of liver in neurodegeneration. The patient need not wait till he lands up in cirrhosis or till he lands up in hepatic encephalopathy to make him realize that okay, liver's health is important for brain health. No, even if it is a very small diseases as a fatty liver, or it can be non-alcoholic steatohepatitis or steatohepatitis which is caused by alcohol, it should be a wake up call for the patient as per the research, both for the metabolic syndrome and neurodegenerative diseases. So if we have to protect the patient from a neurodegenerative disease, or you have to protect the patient from a metabolic disease. For example, let us say that a patient comes to you saying that my grandfather is having Alzheimer's, he also had diabetes, both parents are diabetic, I don't want to be diagnosed as Parkinson's disease or diagnosed with any metabolic diseases in the future. What should I do, doctor? You are an Ayurveda doctor, so what should I do? Now your management should focus on the Agni, and your management should also focus on the liver health. Then only you'll be effectively preventing both the neurodegenerative disease and metabolic diseases. So most of you can ask, ma'am, is it not a genetic disease? How can we contribute in prevention of that? Is he not destined to have that disease in the future? No. Just like you have genetic factors, you also have something known as epigenetic factors. So now epigenetic factors refers to the food we eat, the amount of hours we sleep, the environmental factors, the stress factors. So these are all comes in the controllable portion. So all of this can be controlled. So if you are able to have a very good epigenetic makeup, that is epigenetic factors are very well controlled, that means you're leading a very healthy lifestyle, or where you're eating healthy food, exercising regularly, your weight is maintained properly, your stress is maintained properly. So all of this, if it is done, your epigenetic makeup is maintained well, and with that epigenetic backup, you can also postpone or prevent even the genetic disorders. Okay, so that's where the Ayurveda comes. So that's why the Ayurveda gives a lot of importance to the food. Even ahara is considered as mahabheshaja. So we have bheshaja, so many herbs, so many medicines, 1950 yogas, all of that. But still Charaka told that, or Kashyapa told that ahara is mahabheshaja, because ahara comes in the epigenetic makeup, your vihara, vyavahara, achara rasayana, sadvrutta, all of these are very, very important for the epigenetic health. So recently there was also a research. For example, now to be healthy, all now everyone is very much educated that physical health is important, spiritual health is important, mental health is important, and they're achieving all their goals, they're succeeding in all their lives. But still many of the patients, they land up in health disorders, or still many of the patients face so many issues. So recent research told that the social health factor is very much important and equal to your physical and mental health. For example, if you're achieving so many good things, and still if you're lonely, that means your mental health is also affected. So researchers have proved this. So that's where Sadvritta comes in the role. That's where the Achara Rasayana comes in role. So all of these are told very logically to have health, to very logically to prevent a disease. So yes. So now, as I told you, metabolites from the liver, this we have already discussed, but still to go in detail about the metabolites which are establishing the liver-brain axis. So metabolites, some of the examples are bile acids. It can be ammonia also, and as these also undergo the secondary metabolism in gut microbiota. So this gut microbiome derived metabolites, for example, it can be short chain fatty acids, or it can be gut microbiomes. So they act both in the liver and the brain. So they also serve as metabolites from the liver to the brain. So now these are the two pictures where you can see the liver brain axis. So I'm not speaking about the gut brain axis. Please be aware, awake. I'm specifically speaking about the liver brain axis. So liver brain axis, as I already told you, our autonomic nervous system is involved. You can see the sympathetic nervous system, parasympathetic nervous system, vagus nerve here, sympathetic parasympathetic system, sympathetic, very the two components of autonomic nervous system. And here you can clearly see the gut, the liver and the brain. So metabolites from both the liver, metabolites from the gut, they reach the liver. So here, as I told you, the components which will establish the crosstalk, we have hepatokines, metabolites, and the neuronal pathway here. Neuronal pathway which is established by the autonomic nervous system. You can see the cursor, and the two important components, hepatokines and metabolites, which are establishing the crosstalk. And here you can see the ammonia, the vitamins, the choline, which are both active in liver and the gut microbiome, which are referring, or which are having a communication between the brain and the liver. So neuronal interfaces or neural network, as I already told you, the autonomic nervous system is playing a role in this. The first report suggesting the liver metabolism could be affected by the CNS. So this was done by the scientist named Claude Bernard, and the experiment is Claude Bernard's experiment in 1849. So that a puncture in the fourth ventricle caused temporary glycosuria. So this was an experiment which was done in the 19th century in 1849 by a scientist known as Claude Bernard, who was trying to say that there is a relationship between the brain and the liver. So how did he prove that? So you all know that there are ventricles in the brain. So when the puncture of the fourth ventricle of the brain was done, that patient temporarily developed glycosuria. So glycosuria, the metabolic factor, and which is the factor which is influenced by the liver, and hence he proved the relationship between the brain and the liver. So this also will be counted as the neural interface between the brain and the liver. So as I already told you, even in the NFALD, which on the insulin resistance, which is called as hepatic insulin resistance, there was cognitive decline, which showed us that there is a relationship between the brain and the liver. And also hypothalamic nuclei, I told you hypothalamic nuclei and ANS are responsible for the crosstalk. So now whenever the brainstem and spinal cord, uh, whenever the any disturbances were there in this, there was also disturbance in the outflow to the liver, the blood outflow or the neuronal outflow to the liver. This was also there, and the liver also sends metabolic signals. It can be to the central nervous system via the afferent nerves. So with the help of molecular neurobiology, neural pathways, we can still much more elucidate or establish this relationship better. So I want you to remember the Claude Bernard's experiment, which showed the importance of liver health in brain, or the brain health in liver. Both of these are contributing to each other early in the 19th century. So now therapeutic potential. So why did I speak so much about this? Only because you have to think about this in treating the patient. So whenever you're treating a patient of any neurological disorder or neurodegenerative disorder, there is a scope of better treatment of him by targeting the liver. So that is the main therapeutic potential. So how do we understand this uh, in Ayurveda? See, in Ayurveda, liver disorders, they can be both apatarpana and santarpana janya, because shota comes in santarpana janya vyadi. So shota, which happens in alcoholic fatty liver disease, non-alcoholic fatty liver disease, or it can be non-alcoholic steatohepatitis. So all of this is will come under santarpana janya vihara. And as I told you, liver is responsible for the neurodegenerative disorder and also metabolic disorder. So neurodegenerative you can consider as apatarpana, and the metabolic you can consider it as santarpanajanya. So both of this we have very effective treatment in Ayurveda. You have studied in from Charaka Sutrasthana itself. So all the possible pathologies of NASH, NFALD have been given here. So in the non-alcoholic fatty liver disease, so there is accumulation of the free fatty acids, or there is increased free fatty acids. You can also consider it as abadhameda or durumeda. So this samprapti, if you're interested, you can go and read the Charaka Nidana Prameha Samprapti, Prameha Nidana Samprapti. That is a very beautiful example for all the Santarpana Janyavadi. If you see the pathogenesis of insulin resistance and you read the Samprapti of Prameha as per the Charaka Nidana, they are exactly the same. You will be shocked how come Charaka wrote this beautiful Samprapti of free fatty acids, Abadhameda, many years ago. Okay, so the same Samprapti can be applied here with respect to Abadhameda, Durmeda, especially in the Kapha Prakriti person. As we all know, Kapha Prakriti are the individual persons who are afflicted to be more affected by the metabolic disorders. And the concept of Agni, all of us know that there is Agni. Recently there was a research which was done. It was done on depression and all the factors which were the causes of the depression, or which were the causes of the Mandagni, we would say. The same were the factors which were the causes of gut dysbiosis in depression. So the research was done where all the patients of depression were taken and their gut microbiota examination was done. It showed dysbiosis. And when all their etiological factors of each and every patient were tested, and if you see the Nidan of Agni Mandya, right, so both of them match together, showing that there is a relationship between the Agni-mandya, gut microbiota, and gut dysbiosis. So the same thing I've tried to put in this one single picture. So now for the Santarpanajanya, Apatarpanajanya correlation, we can discuss this one. This can be very much in detail, but still you can listen in this session. So Vata Chakrit Pradhi, steatohepatitis, Vata Chakrit Kshaya, it is initial stage of fibrosis. It can be Sannipada Chakrit with the hepatocellular carcinoma, Tridoshi Chakrit Kshaya, again in the same condition. Metabolic hepatitis, Ama Chakrit Vriddhi, Ama Chakrit Kshaya, if it is a metabolic cirrhosis. We also have Medha Chakrit Vriddhi, non-alcoholic fatty liver disease. If it is Kshaya, it becomes cirrhosis. Pitta Chakrit Vriddhi, non-alcoholic steatohepatitis. If it is due to Madhya, whenever Madhya is Nidana, it becomes alcoholic liver disease. So these are the examples. So the approach to the treatment, so we have to look after the liver health, prevent the diseases like non-alcoholic fatty liver disease prevent. If you prevent the non-alcoholic fatty liver disease, you're by default preventing hepatocellular carcinoma, by default preventing the cirrhosis of liver. So how do you prevent the non-alcoholic fatty liver disease? Just by maintaining a very active and healthy lifestyle. It is as simple as such. So pitta pradhana doshaja, the sthana is ekrit. First, when we are focusing on the liver, this is the chikitsa siddhanta, the dosha dusha sthana status here. When you're focusing on the apatarpanajani or vataja, so this is the status, vata pradhana dosha, Mastishka Majja is the sthana. So Shodhana, Shamana, Rasayana are the three modules of the treatment which we have to adopt. So for Shodhana, Virechana and the Basti to target both Pitta and Vata dosha. Shamana, Pitta Pradhana Dravya Prayoga for Pittaja, Agni Deepana and Amapachana to focus on the gut metabolites. Pitta Shamana and Rakta Prasadana to focus on the Pitta dosha. For Rasayana, so in the liver disorder treatment itself, for example, in Jalodhara, you have Kshirapatya Prayoga. So somewhere they're saying that Kshira is very much essential for the liver health. Okay, so recently in the research, it was proved that we all know that in the Jalodhara Chikitsa, 6 months of Kshira or 3 months only Kshira you have to give, along with that Kshira and Yavagu you should give Kshira, all of that it is given. So Kshira is very much important for the gut microbiome. As I told you, the gut metabolites, they give away all the information of the liver to the brain. It is just like a spy, right? Spy is telling all the uh, defaults or defects in the liver to the brain. So now we have to remove those bad gut microbiome and implant new gut microbiome. So many of the times we think that okay, Kshira is there, Kshira is Virechaka, so it will bring down or take down all the ammonia from the gut. It will prevent hepatoencephalopathy. Very good. That is also one of the important concepts why Kshira is written. And second point, Kshira is an excellent source of protein. In the case of Jalodhara, protein is being lost and the protein supplementation should be given. So Kshira is given, yes, correct. And third important point, which is necessary, is it implants the good microbiome. So whatever gut dysbiosis is happening, Kshira is that one cost effective dravya which will impact the gut microbiome. So Kshira, that's why by these three important methodologies, Kshira has been told as a rasayana or as a pathya. Okay. So now I'll tell you what is the importance of the Shamanaushadis or whatever dravyas have been told in the treatment of liver disorders. Do they really help liver and how do we get to know? So for example, I'm taking HT Madhu. So it is helpful in treating the liver disorders. It helps treat disorders like jaundice, hepatitis, non-alcoholic fatty liver disease. It also helps with drug-induced liver injury. So many of the times, even with a drug-induced, it can be paracetamol drug-induced or it can be even Guduchi-induced drug liver injury, all of that. So it helps in treating of that. It prevents liver damage. So when our experiment was done on uh, CCI4, that is carboxy tetrachloride rats, carbon tetrachloride rats, whenever this experiment was done with HT Madhu, it helped in reversing the liver damage. So that HT Madhu is helpful in reversing the liver damage. It also improves the liver function and metabolism. It reduces the inflammation and it also increases the level of antioxidants in the liver. So next is Brahmi. So Brahmi is important for both liver and the brain. So it is an hepatoprotective, the ethanol extract of Bacopa moneri. So it helps in the liver damage. When the experiment was conducted by the nitrobenzene induced liver toxicity and Brahmi was given, it helped in both the liver toxicity and kidney toxicity. And we also know that Brahmi is very good Medhya drug. It is not mentioned in Medhya Rasayana amongst the four, but it is a very excellent drug for the neuronal health. And next is Pippali. So Pippali for both the brain and both the liver, it acts as a very good rasayana. So it helps in the cognitive neurodegeneration. It also helps in the memory impairment, and it also helps in hippocampal function, and it is also a rasayana. It brings down the inflammation of the liver. So both the liver and the brain can be targeted by this simple Pippali rasayana. Next is Rohitaka. All of you know the drug which is very difficult to procure. It is getting almost impossible to get good quantity and quality of Rohitaka nowadays, but still there are some sources which you can. So even the Rohitaka, it it brought down the insulin resistance, it improved the metabolic health, and it also prevented the development of NASH, that is non-alcoholic steatohepatitis. So it helps in the liver health and also it brings down the oxidative stress. So if there is any So oxidative stress mainly is responsible for the development of diseases. So if you bring down oxidative stress, you're also bringing down the probability of that disease manifestation. So this Rohitaka does that for both the brain and the liver. And next, as you all know, Virechana and Basti, Virechana for Pitta dosha and Basti for Vata dosha. So it helps in the detoxification of the liver, and once the detoxification is done, then whatever the substances or metabolites which will cross the blood brain barrier would also be of good quality. It will not be of any toxins or endotoxins or inflammatory markers. So it also helps in gut health restoration and microbiota modulation. So that means if there is gut dysbiosis, all those gut bad gut microbiome will be replaced by the good microbiome, or else it gives the space for the good microbiome to grow in that. So it balances the pitta and also the rakta, and hence it brings down the inflammation, and it also acts on the agni. So all of this phalashruti is given in the Virechana phalashruti. The same thing have been which have been proven by the research I am taking here. So Basti, it acts on the gut brain axis. We know that for all the neurological functions, it can be anidra, or it can be pakshaghata, or it can be chittodvega. So many of the times we take the help of Basti because it acts on the gut brain axis, and also it acts on the gut liver axis. So it helps in the systemic absorption because that amount of quantity of the drug we cannot give orally. For example, if you are giving 350 ml or 450 ml of Basti, the same thing cannot be taken orally. Right? Even if you take, then there is first pass metabolism. Amongst that, the bioavailability comes down. But in the Basti, with the help of the mucosa, most of the drugs are taken, and the amount of the drugs which are taken is more. So systemic absorption is more with the help of Basti, and it also helps by addressing the liver brain connection, because the metabolites, again, was whatever I was telling you, only the good metabolites will be reaching the brain. So this is all about the Shamana Aushadhis, the two important Panchakarmas, Virechana and Basti, the communication between the liver and the brain. So how, just by how acting on the liver, you can protect the neurodegenerative diseases. So now the session is open for questions. If there are any questions, I can take up. Are there any questions?
Ma'am, there are some questions in the chat box, ma'am.
Okay, let me take. I'm not able to see the chat box. 1 second. Yes. So the first question is by Dr. Anjali Kotian. The difference between the gut brain axis and the hepatocerebral axis. Uh, yes, a very important question. So both of these are two different pathways. Why we get confused is because they are somewhere interdependent on each other. But the gut brain axis, it is a bidirectional communication. It is between the gut and the brain, that is central nervous system and the gut. So here the key component will be of microbiota, the vagus nerve, the short chain fatty acids, enteric nervous system. Okay, but in the hepatocerebral, that is liver brain axis, that bidirectional communication here is with the liver and the brain. So here the key components will be like the permeability, or it can be the bile acids, the ammonia, cytokines, which are pro-inflammatory markers. So these will be the communicators between the liver and the brain. Uh, and even in the disorders, you can see, for example, in gut brain axis, you can think about irritable bowel syndrome, or it can be many of the psychiatric diseases like anxiety. But in hepatocerebral axis, we are speaking about cerebral hepatic encephalopathy, or it can. Chaitra Kumar is asking me, what if the person is lactose intolerant? Then instead of kshira, what can be given? So if the person is uh, you know lactose intolerant, that means he's not able to digest kshira, then the easy method is you give any Deepaniya Dravya with the kshira. So start it with small amounts of kshira, then add any Deepaniya Dravya along with it. You can give a shunti along with kshira, then you can try with the patient. But if that is also not possible, and the patient is already a case of hepatic encephalopathy or any hepatic disease, then in such cases you have to avoid kshira. But in most of the times with the Deepaniya Aushadis, with kshira can be given. But in the terminal cases, I'm saying. Okay. Uh, Ma'am, can you explain regarding effect of hepatocerebral axis in the view of Arohana Shodhananga Snehapana done as Purva Karma for Virechana and Vamana? Can you, if Dr. Anjali Kotian is there, can you please ask me the question? I'm not able to get this question. Arohana Shodhananga Snehapana, yes, it is done in all the cases. Huh. Yes, yes. During Snehapana, do you want to? Huh, huh. Shodhananga Snehapana for cerebral axis. I think there are different things. Snehapana is done based on keeping the dosha and the dushya and the vyadhi. The sneha which you select for metabolic disorders are different. The sneha which you select for maybe neurodegenerative diseases are different, or any category of diseases is different. For snehana shodhana, that is an entire different concept. But if you're asking me how the snehana before shodhana works in case of any diseases with which is lined with the hepatic disorder, which is lined with the hepatocerebral degeneration, then definitely, for example, as I told you, so Ghrita is a very important component which will bypass the blood-brain barrier. So that is the reasoning why in the Unmada Apasmara, more of Ghrita yogas are given. So in such condition, if you select an ideal Sneha, which if you're targeting metabolic disorders, then those dravyas for it can be Pipali, Trikatu, or it can be Panchatiktaka Grita, whatever it is. If you're targeting the neurodegenerative or neuronal, then it can be Kalyanika Grita, Panchatiktaka Grita, any of it. So the absorption of those drugs will be more because you're giving it in the form of Grita. But the same is applicable if you're giving in Brahmananga Sneha or Shamananga Sneha. Uh, yes. Ma'am, is hypothyroidism related with insulin resistance? See, insulin resistance, as I told you, it is a very important phenomenon in most of the metabolic disorders. So, what is insulin resistance? I think you all are very much clear with what is insulin resistance. There is you eat food, then there is glucose spike, then the insulin is released to bring down this glucose spike. But if you are having so much of overeating or so much of overweight, or the insulin stops reacting in the same pace as before, so more insulin is produced and the resistance is formed, so insulin is not able to bring down the glucose level, right? So this category of disorders are PCOS, it is diabetes mellitus. But hypothyroidism, it is a thyroid gland dependent disorder. So you have hypothyroidism, you have autoimmune thyroid disorders. So there, thyroid hormone is more mainly affected. And thyroid hormone is also a very important factor, which is having a role in everything: your body temperature, your skin, your bowel movement. So thyroid is again like a master gland, it acts on everything. So there, thyroid is the main factor. The that is the number one factor. Along with that, there can be or not be insulin resistance, but whenever hypothyroidism patient comes, the thyroid gland or the deficiency of thyroid hormones is what we act upon. But in Ayurveda, the line remains the same: Santarpanajanya, Apatarpanajanya, you do the Shodhana. So that line remains the same. But when you compare with the modern, whatever is happening, the contemporary thing, the thyroid gland physiology, the pathology, that comes first. Because again, just like insulin resistance is a huge spectrum which is resulting in a number of disorders, thyroid hormone is also a very master hormone, as I told you, from the body temperature till the infertility and even the simple complaints like constipation, it is responsible. So that should be the number one focus. Can you elaborate importance of fecal microbiome transplants in acquired hepatocellular degeneration? Any Ayurvedic medicine alternative which works as gut microbiome enhancers? So fecal microbiome transplants are very much in now, but as such in acquired hepatocerebral degeneration, there are no any till now a verified source of a study which will say that they are bringing much more importance in improvement of hepatocerebral degeneration. The more focus still lies on the prevention and the management. So any Ayurvedic medicine alternative which works as gut microbiome enhancer. So you need not worry about any alternative. You have excellent Shodhana procedures. So Vamana works very beautifully on insulin resistance. You can just do a simple test as fasting insulin, postprandial insulin. You can also do tests like HOMA IR, which is a specific test for insulin resistance. You can see very much improvement in Vamana. And both in Virechana and Basti, there are scientific studies from the verified sources which show that there was improvement in the hormonal level, in the genomic levels. Like you have 16S rRNA, which is a very important gene which is affected in disorders like rheumatoid arthritis, right? So in the improvement of this, or in the improvement of gut biosis, this Vamana, this Virechana and Basti had a huge role to play. So these are not just alternative, but the mainstream therapies for gut microbiome in Ayurveda. And along with that, you also have like Takra Prayoga in Ashas, Takra Prayoga in Grahani, which are focusing on the gut microbiome. But the importance of fecal microbiome transplants, again, it is a huge area which has to be studied. I hope I have answered your questions. If you're still not satisfied, you can unmute yourself and ask me. I'll be happy to answer. Any more questions? Any questions? I hope today's topic was just like a quick brainstorming session for you, just to think in multiple various ways and how Ayurveda can contribute.
Ma'am, I think only these many questions are there.
Okay, thank you all. Thank you for your valuable time, especially in the weekend, especially in the evening of a weekend. If there are any questions, you can directly mail me or you can contact me. I wish you all the very best. By seeing all of you, I can feel that Ayurveda is in safe hands. If you're able to join for a session on a Sunday evening, what more to ask? I thank the Ayurdrashti for giving me this opportunity, and thank you, Sri Shail, especially for your patience, because this was supposed to happen in June. There were so many things to do, so many of my exams also, and he waited patiently for the session, and even he was very much eager to listen about this topic. I thought of presenting any case study, but he was like, no, we want to know more about this. So kudos to you, Sri Shail, and the entire team of Ayurvedic. I'm so much happy. You're having a wonderful community. I'm so much impressed by this community now, just by not just by the numbers, but also the questions which were asked. Thank you. Good night.
Thank you, ma'am. Thank you so much for making us understand the relation between liver and the brain. We are very happy this Sunday that we